Now, using our 3 steps, let's break this down. This question's asking for incorrect student statements regarding the key problem, sucralfate. So before looking at the options, we're thinking sucralfate treats ulcers, it kind of coats the gut to kind of fill in the potholes, those holes, ulcer holes inside the GI. So just think the memory trick that we use for sucralfate is we always take sucralfate 2 hours before or after you ate. Now we're talking about eating food and also eating meds here. The hard one is to remember the meds. So the solution is remarks by the student that are false regarding this med. So option number 1 is incorrect here. The medication can actually cause constipation. Now option number 2 is the most correct because, guys, we don't take it with other medications because it's going to block or compete for absorption here. And option 3 and 4 we have to skip because those are technically correct. Guys, we take those after meals because sucralfate, we take it 2 hours after you ate. And option number 4, you don't take with other meds to decrease absorption. So option number 2 is our most incorrect option, and that's why we have to choose it. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the priority side effect regarding the key problem, taking metoclopramide. So before looking at the options, we're already thinking tardive dyskinesia and GI upset. So the memory trick we use to help you remember this is M for metoclopramide is M for major face funky movements all over the body. Well, not all over the body, but all over the face at least. So the solution we're looking for is the worst potential side effect, which is our facial movements with metoclopramide. So option number 1 is incorrect. Insomnia, all over the face at least. So the solution we're looking for is the memory trick we use to help you remember this is M for metoclopramide is M for major face funky movements all over the body. Well, not all over the body, but all over the face at least. So the solution we're looking for is the worst potential side effect, which is our facial movements with metoclopramide. So option number 1 is incorrect. Insomnia is possible with a side effect for this drug. Now option number 2, that's our big one here. That one's correct. Frequent batting of the eyes indicates tardive dyskinesia. Now I've seen some other questions say like, lip smacking, or like puffing of the cheeks, or like weird funky face movements is also a side effect here. And the last 2 here, option 3 and 4, are both incorrect here. So restlessness is a possible side effect, and also diarrhea is a possible side effect. So just remember, M for metoclopramide is M for these funky face movements, or M for these major face movements. Okay, that wraps it up. For more details at Now, using our 3 steps, let's break this down. This question's asking for findings requiring intervention for the key problem, ulcerative colitis flare-up, and the patient is taking sulfilazine, so POVID. So the biggest thing I'm thinking is that it's a sulfa medication, and there's probably a lot of inflammation and pain with ulcerative colitis. So the memory trick we use is sulf for sulfilazine here. So S is for sun-dried body. Guys, the patient gets really dehydrated and they have to stay out of the sun. U is for urine crystals, or a bunch of kidney stones from that dry body. And L is for low urine output. We're talking dark, heavy urine from this dry body. So just think, if the body is dry, then the specific gravity is high, very low urine output, and really dark. And lastly, F is for folic acid as well as fluids for this dry body. So the solution we're looking for are findings that requires the nurse's attention right now. Now option 1 is incorrect because SED rate is high, but this is to be expected with a UC or ulcerative colitis flare-up. Guys, the patient is having many loose stools a day. That's really bloody. So option 2, the H&H is slightly low from those bloody loose stools. So that's technically incorrect because it's expected. And option 3, abdominal pain from watery diarrhea. Guys, this watery, bloody diarrhea is expected. That's what ulcerative colitis is. And option 4 is the most correct here because concentrated urine can indicate dehydration. So remember the memory trick, SOLVE, and you should get your sulfilazine questions correct. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking for priority findings to report for the key problem, diabetes, taking metoclopramide. So before looking at the options, we're thinking tardive dyskinesia and maybe some GI upset. Now to help you remember that, the memory trick we use is M for metoclopramide, is M for major facial movements. So just all those funky face movements is our tardive dyskinesia. So the solutions we're looking for are findings that might indicate this tardive dyskinesia or the worst possible outcome. This question is asking for priority findings to report for the key problem, patient with diabetes taking metoclopramide. So the biggest thing that I'm thinking is tardive dyskinesia and possible GI upset. So the memory trick we use is M for metoclopramide is M for major movements, typically face movements, but tardive dyskinesia, we can just have some funky movements here. So the solution we're looking for are findings that might indicate this tardive dyskinesia. So option number 1 is incorrect. Abdominal discomfort is expected. It's technically a side effect of this medication. And option number 2 is pretty close, but it's incorrect here. So flatulence is an expected side effect here. Now option 3 is our most correct. Hand wringing is an indication of these just funky movements or major movements. It's an indication of tardive dyskinesia. And option number 4 is incorrect. Watery bowel movements is expected with this medication. It's basically a side effect. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking for interventions to implement regarding the key problem, feeding pump that's not infusing. So we need to assess the patient, assess the residuals inside the GI tract, as well as assess the pump. So the solution we're looking for are actions to take for this patient right now. So option number 1 is correct here. Guys, when an order is not administered, we have to fill out an incident report for any mistake on the nursing floor. Now option 2 and 3 are also correct. We have to notify the HCP since the additional prescription or orders may be needed since the feeding that was ordered wasn't given. And option number 3, we always assess. So assessing the blood glucose will help see if the patient's hypoglycemic, because technically we don't really know if this patient is diabetic, or basically they've not been receiving their food and now they could be low sugar. And option 4 and 5 are incorrect here. Guys, it's not a PO medication. This patient's on gastric tube feeding. And option 5, there's no indication that the family is even there, so we have to assume that they're not there. Now, using our 3 steps, let's break this down. This question's asking for which script for the key problem needs clarification with the HCP. So before looking at the options, we're just looking for the big error here. So the contraindication, the big safety issue here. So the solution we're looking for are which order or prescription is not correct. So option number 1 is incorrect. So this patient needs this medication, and even though it can cause constipation, the patient still needs pain management here. Now option 2 was a little bit tricky, but it's incorrect. This antibiotic is not related to penicillin, so there's no allergy risk. Guys, remember, psyllins and ceps, those cephalosporins, they have the cross allergens. So option 2 is safe. And option 3 is our most correct here. So remember, dicyclamine or dicyclamine puts the dry cycle on me bowels. This would cause decreased peristalsis and no bowel movement. So just think paralytic ileus. Guys, that's a huge emergency. We're talking dead bowels here. The patient can have an SBO or a small bowel obstruction and probably even perf or explode their bowels. So that's the most dangerous. Lastly, option number 4, that's incorrect. This medication is given to help excrete uric acid with tumor lysis syndrome, and so technically it's appropriate. So option 3 is our most correct here. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for which question to ask for the key problem 55-year-olds on a prazole or omeprazole for about 6 months. So we know that prazoles are PPIs. They decrease nutritional absorption as well as change the gut normal flora. So the memory trick we use for prazoles are the 3 P's for prazoles. So P for they prevent ulcers, or basically holes in the GI tract. They P are for porous bones, so they cause osteoporosis. And the last P is for possible infections here. So the solution we're looking for are queries or questions to ask the patient related to this medication. So option 1, 2, and 3 are incorrect here. We don't need a drink with a full glass of water. And option 2, the medication can be taken after you eat the meal, not between meals, but usually immediately after. And option 3, the colon or endoscopy is not required with this medication. So option 4 and 5 are correct here. So option 4, ADEXA to check bone density. Guys, the med can affect calcium absorption. Remember, P for porous bones. And option number 5 is also correct. A cough can indicate a respiratory infection, like pneumonia, which is also a side effect of long-term PPIs. So remember, possible infections. So you guys would have got this question right if you remember the 3 P's of PPIs. So always make sure to know your memory tricks before you approach the options here. Okay, that wraps. Now, using our 3 steps, let's break this down. This question's asking for the most susceptible complication regarding the key problem, those long-term prazoles, those PPI, proton pump inhibitors. So, before we look at the option, we already know this patient is on a prazole, right? So we're thinking decreased GI acid, changes in the gut environment. So we use the memory trick, the 3 P's of prazoles with our PPIs. So P for it prevents ulcers inside the GI tract. The second P is for porous bones, leading to osteoporosis. And the last P is for possible infections, specifically C. diff infections, because it changes the pH level inside the gut. So the solution we're looking for are anticipated problems with taking this prazole long term. So option number 1 is correct here. Changes in the GI environment changes the normal flora, leading to infection risk. Now option 2 is incorrect because esophageal cancer is not a complication of long-term prazoles with our PPIs. And option 3 and 4 also incorrect. Tremors, not a complication. And guys, peptic ulcer is not a complication. We actually give this to treat peptic ulcers. So option 2, 3, and 4 are incorrect. Okay, that wraps it up. For more details and Now using our 3 steps, let's break this down. This question is asking for contraindications to the med. So the key problem, patient is ordered dicyclamine or dicyclamine. So this is an anticholinergic that dries out the body. So the memory trick we use is dicyclamine or dicyclamine is a dry cycle. Everything in the body is dry here. So the solution we're looking for is documentation that indicates contraindication, or basically why we would not give this medication. So option number 1 is incorrect. Abdominal cramping and watery diarrhea is the reason why we give this medication. So we want to dry the bowels out if the patient is just going way too much. Now option 2 is our correct option here. The medication can cause urinary retention, so patients with BPH, this benign prostate hypertrophy, it can cause the same, worsening the problem here. So option 2 is our most correct. Now option 3 and 4 are both incorrect here because bilateral cataracts is not a contraindication. And slightly low red blood cells, again guys, not a contraindication. So what would make it worse is option number 2, if the patient has urinary infrequency or basically cannot pee from that big prostate, tricyclamine or dicyclamine would make it worse here. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking what to do for the key problem. A preschooler may have taken some aspirin. You know, those preschoolers getting all crazy nowadays. Okay. So before looking at the options, we're thinking aspirin toxicity, we need to prevent the reabsorption or prevent the absorption here. So the memory trick we use for aspirin toxicity, we use A, activated charcoal, to prevent the A, aspirin toxicity. So the solution we're looking for are interventions of what to do for this child right now. So option number 1 is incorrect here. Acetylcysteine is the antidote for acetaminophen. So guys, not aspirin. So option number 1, let the name help you. Acetylcysteine is for acetaminophen there. Now option number 2 is correct. So activated charcoal will bind and decrease absorption with the A, aspirin. Now option 3 and 4 are incorrect. There's aspiration risk with a gastric lavage and another aspiration risk with Ipecac. Now option number 5 is correct. We need to assess this patient and assessing signs and symptoms of aspirin toxicity, which typically is about ringing in the ears, this tinnitus. Okay, Okay, that wraps it up. For more details and test